Healthcare RN, every month they may want you to go flush it with what? Heparin. To keep it what? Open. And when you go flush one of these, the people need to pay you $65. I'm telling you, RN. Certain things when you do home care don't be getting no little money. Wound vac, you need to get good money. Vancomycin and put heparin. Something just simple they need to pay. When they just dress and change, 26 take it. But big stuff, the insurance company pay them extra for that. A Vanco, the insurance company pay the facility $2,500, and they pay you $26 an hour. Now, baby, you gotta know what you worth. When I did home health care, I killed them. Oh, you want me to do a wound vac? Okay, $115. You want me to go on? You gotta know what you work. Students, oh, okay, I got a job. $8.10. Okay. No. You gotta know what you work. Oh, Vanco, they pay you more. Is it Medicare? Boy, you got more for that. You ain't gonna pay me no $20 to go hang no Vanco. Vanco, you gotta sit there with the patient till it's finished. So you work more. Y'all didn't know that, huh? Talk to them. You don't have to be rude. You just talk to them like you know. Because people use you. Because you don't know. Well, you don't know. I'm going to pay you whatever. But if you say, hey, Vanco, ma'am, you got more than that. No. Yesterday, not today. All right? Okay. So, now, so that's where it says access for hemodialysis. Here's the port. You have to hear bruit and thrill. Any question? Bruit and thrill meaning the port has to be open. Who got your dialysis now? Why? No. You cannot put an IV on that same arm and you cannot take vitals. No. The opposite. Y'all know that, right? Boy, some LPN out there in the working field, I feel sorry for you. And don't be an LPN and all you do go to people's house. You're not a real LPN. You need to go work rehab. And don't be no damn RN, you working in a rehab. I understand a job is a job. I'm not knocking nobody's job. You need to be an RN and work in hospital. You see, when you are RN and you work in the rehab, they call you klebish out there in the real world. They say you don't compare to this person. You need hospital. You get your license, you find a hospital that's going to put you a student nurse. They pay $19, you take it. When you got wings, you out. You go to telly, you go to big stuff, but you don't get your RNA fair rehab. No, come on, know what you work. When you get the license, come talk to me. I'll tell you where to go. Wellington, they got a student. JFK, Del Rey, student nurse. Yes, they pay nothing. You don't care. Your goal is not to go stay there. Your goal to do 1 year. Hey, okay, goodbye. Not rehab. I'm supervisor. Rehab. You got to know what you want. Right? When busy teach your brain. Right? When Bible No, you work something. Know what you work. Jesus. Anyways, let's go. When you have hemodialysis, there's 3 complications that occur. 3 complications that occur. Anytime you have hemodialysis, I'm making y'all bad, I'm sorry. Because nobody will tell the Haitian community nothing. So I'm trying to educate y'all, to get y'all body. You got to be a hustler. See, you can be from Haiti and still Americanized. You know, you got to know your rights. Let's go. Okay. Complication of hemodialysis. That means anytime you have venous dialysis, if you don't have a ride home, I will not do it. Anytime you do hemodialysis, you must have a ride home. Why? Because after dialysis, you loop. Only the hemodialysis, they call it what? Dialysis encephalopathy. Loop. It's the last one. It's C737. Anytime you got venous, you at risk for something that is called dialysis encephalopathy. So NCLEX asks you, it's 737C. I started that first because that's the #1 NCLEX question. They say after dialysis, what's priority? Safety. Student never take it. The students say, boy, what safety have to do with dialysis? Hemodialysis. You gotta lock the door. Or you put them here, you find them on Jog Road down the street, naked in the street. After hemodialysis, patient tends to be loop. That's one complication, right? The second complication is called Disequilibrium Syndrome. Here it is. Let me tell you what happened. So I'm doing dialysis on Susan, and guess what? I remove the blood too fast, or Susan was having a problem, I stopped the blood. I just killed Susan with VT. I just killed her. Why? Because I stopped the machine, what? Too quick. So she go into what? VT. Disequilibrium syndrome means that's why dialysis, you don't do it too fast and you don't stop it. Let me explain to you. The first thing, Susan having complication, you slow down. You reposition Susan. You give her oxygen. If all that don't work, then you stop it because you didn't have what? Choice. But you don't go stop it quick because you will kill Susan. Why? Because you pull the blood out of her. You're not God and you go pull blood out of people too fast. #1 reason why dialysis technicians go to jail. They texting patient on dialysis, the machine going too fast. And dialysis is money. Let me explain something to you. The machine is washed for 2.5, 3 hours. The machine. The dialysis is normally done 3 to 4 hours. So one patient right there, there's 8 hours, right? Some RN so greedy because they pay them either $45, $55 an hour. Some RN try to do 3 dialysis patients a day, no good. There's only 8 hours. There's 8 hours, right? There's 24 hours in a day, but 8 hours, 8 hours. I can see you do 2 dialysis, but you're fat. Why? That means the machine doesn't have time to what? Clean the patient at risk of catching AIDS. She used the machine last week. She used the machine this week. If you don't clean the machine, she's at risk for Hep C, AIDS, Hep B. But because of money, greediness, you go do 3 dialysis. You put patient at risk. #1 reason why people die of liver cirrhosis, Hep C, where they get it from? Dialysis. HIV, where they get them for dialysis. All because of dirty what? Yes.
How often do they clean it?
You're supposed to run the machine sterile, run cleanser for 3 hours. Or some agency want 3.5 hours before you go. And this is what Vitas do. They go to university and say, look, let me rent a suite. Or let me rent a room. She come 8 o'clock. She come 4 o'clock. We still use the same what? Machine. So we did not have time to wash the machine. So I did one 8 to 4. Then I do one 4, right? Then I sleep a little bit, go take a 2-hour break, come back to do one at midnight. Not all money, good money. That's a killing money. Right? That money gonna choke you. Okay. Right? They know. And that's why it's bad when you are a CNA and you let Vitas train you. Boy, you're not trained. I can see an RN, a dialysis, yes, because you got that assessment too. You CNA, wait for dialysis soon. No, that ain't right. But yeah, a lot of CNAs do it. And they get paid good, $20, $18. Did I tell you a career to go into? A lot of people thinking, oh, if this nursing stuff don't work for me. No, stick to it. Air embolism. While you are doing the dialysis, right, air get into the line. The patient can die from what? Pulmonary embolism. So there's 3 complications of dialysis. Hemodialysis. What are they? Air embolism, disequilibrium syndrome, and what? All right. Good? All right. Here it is. Page 738. His name is Ricky. Everybody say, hi, Ricky. All right. Ricky is very big on your test. Right? So, Ricky, you will do it at home. And Ricky, this is called peritoneal dialysis. Peritoneal dialysis. Okay? Right? Dialysis. Now, NCLEX asks you a lot of questions. First of all, let's evaluate the picture. Because you see, students don't look at no picture. And that's where they kill you. First of all, we're going to evaluate the picture. Ricky is on page 738. Now, photo. NCLEX blemo avec photo. Yo tout yo. Application sous photo. Pour dire pour pas étudier photo. NCLEX asks you a lot of questions on the picture. Nobody even look at the picture. Right? Because I don't see words, therefore I don't need it. Psych. You need it. The water on the top is called a diastole. What the globe? Clean water. It is sterile. You see the water? It's called diastole. Globopla. Everybody see it. In the bottom, you see a bag on the floor. They call it the dirty water. Boy, NCLEX asks you so many questions on that damn water. Right? Now, then NCLEX asks you, where's the water going in? The peritoneal, stomach. Stomach, turn off the phones. The stomach. Right? So, the water is going into the stomach. Let me ask you a question. You see a lot of little arrows, right? Now, if the bed is elevated, what happened to the arrows? If the bed, not the pillow, because you see Ricky on one pillow, and you see the bed is flat, Now, imagine if the head of the bed was up and Ricky was on a pillow. What happened with the water? It will go in too fast. We don't want the water to go fast, right? We call that what? Osmosis. We want the water to go down a certain way via gravity, very slow. Because if the water go in too fast, we got problems. If the bed is high, so the bed should be flat, and Ricky should be on one pillow. Well, a pillow. Just a pillow. Just remember a pillow. Now, this is not the same as hemo. Hemo vitas do it. This, you gonna do it. But here it is. This is ordered from doctor. Now, water goes in the stomach, right? That's how this cleans the blood to remove the uric acid. This is a type of dialysis. So, Miss Sonia, let's go to D on page 738. Since we already talked about the bed, let's talk about the water. The water is called diacylate. The water is sterile. So you must use sterile gloves. Stay with me. What is in the water? Potassium and glucose. And if you are a diabetic patient, I'm going to put insulin in it. If you are a heart patient, I'm going to put the digoxin in it. If you are a patient that have clots, I'm going to put heparin. So her water is different versus her water. All diacylate change according to the patient. She cannot use my diacylate. I cannot use Susan diacylate because Susan diabetic, I'm not diabetic. So what's in Susan diacylate? Insulin. NCLEX question. Because the diacylate got potassium in it. Anytime you're going to do peritoneal dialysis, you must check potassium. Any question? Deep pump. Now, the water goes in the stomach. Miss Sonia, who order how long does the water stays in the stomach? The doctor. That is called the dwell time. Right here. ED. The dwell time. The dwell time. Who see it? Who don't see it? The dwell time. Vitas. The doctor gave you an order. How much to take off? Dwell time now may order pusa. The dwell time is how long the water stay in the stomach, the peritoneum. And it can stay from 30 to 8 hours. 30 minutes to 8 hours. Boy, you cannot let it stay more. You cannot let it stay less. You got to let it stay according to the what? Order. Right here, it's in the book. 30 minutes to 8 hours. Right here. The doctor ordered that. You with me? Who's not with me? Raise your hand so I can show you. Problem students yo, oh mon Dieu, yo pa konnen le moun yo mande yo la, oh la, ça c'est yo we dialysis, yo oublié ça, yo oublié ça. You must know hemo versus peritoneal. Now, then NCLEX asks you about the water on the floor, the dirty water, glossala, which is called outflow. There's two questions I can ask you from the dirty water. Why is it not so much? And why is the color changed? I can ask you two questions. Why is the color not clear and odorless? Or why is the water so small? Let me explain to you. If I give you 1,000 cc to drink, I should at least see 800 in the bag. 200 stays in the body, 800 in the bag. Why? It's only 500 in the bag when I put 1,000 cc in your stomach. Ready? It's because you're constipated. Every time you're going to do peritoneal dialysis, you must give me fiber. NCLEX question. Right here. Abnormal outflow and insufficient outflow. We are insufficient. That means the water that's in the bag is too little. Anytime the water is too little, it has to do with patient constipated. So here's the NCLEX question. What is the teaching you're going to teach a patient who's going to get peritoneal dialysis? Or they say, which food you going to give a patient who's going to get peritoneal dialysis? Student, you jump up so I can get fiber. Because they don't know you need high fiber food. Any question? We cool? We cool. Now, I want to know, why is the water dirty? The water that's on the floor, although it's dirty water, it still have to be clear, odorless. If the water is red, vascular, you poking something. If it's brown, it's stool. If it's yellow, it's urine. If it's cloudy, it's infection. That infection called peritonitis, which is a medical. Yes, NCLEX question. Again, if the water is red, vascular, what poke, PK, right? If it's yellow, PP. Hi. How you doing? The class, I have to make money. How was it? Valeo. Me baby.
I was to take my test on Thursday. I used to sit in the back.
In the back. Quiet. That didn't go sound. Yes, go ahead.
I went to Florida, take my test. But I wasn't ready to do it. My friend Danny said, you don't pass, you need to go to Hawaii. I said, no, I'm not going to Hawaii. Because I know exactly, I didn't study. I didn't touch the fundamental, the skill fundamental. I have that book at home, but I never touched it before I went to take the test. And when I came to Miss Sonia came with that, the green book and the skill. And I said, oh my, I'm already an LPN. Why should I use that green book? And I was so upset. I called Miss Carrie and I said, you give me the wrong book. And she said, no, that's the book we use. But from my experience, guys, I think this is the best book to use. Because you have more detail. I bought the Saunders, the other Saunders.
The yellow one.
The new edition. I didn't use it. Because when you use the green book, they have more detail. You understand more. When you read, you can see all the nursing intervention and you see, the skill and everything. And guys, from my experience, the skill book is 2 things that make me pass. I listen to Miss Sonia. I follow, you see, you give us something. Yeah, they have the outline. Yeah, this the outline. So that's what I follow. I follow the outline. I read the green book and the skill book. And if you have to do, I don't know. For me, I use prep you. I use prep you because prep you is simple and the rationale. You know, when you read through them, you can understand. You can, and you know, all my question was about 75% was from the skill. It's little thing. Little thing
Like, from the skill book.
You know, they, after the test, they make you, I don't do a survey, you're not supposed to tell everything, but like something like how to collect, you know, stool specimen. Something they put a little thing and just to trick you. I had something about select all that apply. Anorexia. I have something about schizophrenia. And it's like I get you know something, you know.
Easy, not too bad.
It was easy. I went to Florida. But the first time I went, I was like shaky because I wasn't ready.
This time you ain't had to shake, baby.
And I have 75 questions. But I take like every question at least I take 2 minutes. 2 minutes. I was about to finish. I have like 5 questions left, and that's when they were gonna give me a break. I didn't take it.
That's right, girl.
After I finished taking my class, I said I passed. I was smiling when I
Did you smile before?
No, I was shaky because I wasn't ready. I remember when I went for my first test, they gave me a lot of EKG. They gave me a lot of EKG the first time. They gave me another one. I said, oh my God, I'm not good at EKG. They gave me another one. They gave me another one.
This time you get
just one, something about multiple PVC. And Miss Shona was doing it and said when you have multiple PVC, it's a better emergency. I remember Miss Sonia was taking one of the students, walking, you know. That's what I got. This little thing. Sometimes people say, oh, my test was easy, and people upset. No, my test was easy.
Because you studied.
The first time I went, my test was hard. Because I have all the ABCs, all the EKG, and everything. I failed my first test.
That's what I'm telling you. God made me fly, made me I'm proud of you, guys. She said in the back. She said, boom. All right, baby. See? See? Not the skills. And then and people always say English. My baby didn't speak all that English, but probably I said 75. And then the people tell her test was easy. It's because she read. Listen what she said. I know I passed. You get the result. When I get the license, I bring it to you. My little big. I know I passed, Miss Sonia. I know I passed. When I bring it to you. Wow. Huh? Of course she confident because I kill y'all with the mama papa. But she listened. She don't say boom. I have to see. She said all the way in the back with a girl that with a happy face. I didn't even know she LPN. I didn't know she was an LPN. Today the first, I didn't know. But good job. Okay. Let's finish. Okay, yes, Miss Sonia, someone asked. Yes. So insufficient outflow has to do with fiber. When the color is changed, it has to do with what? Poo-poo, either it's poop, it's urine, vascular, or peritonitis means infection. Now, complication, hold on, I'm going to get you out of here. Let me do this last part. What were the 3 complications that happened here? Disequilibrium, air embolism, and what? They're not the same complication. The first complication that can happen here, the water is too cold. If the water is going too cold, I can start cramping. So the first complication in peritoneal dialysis is stomach pain. Page 739. So the dialysate bag will come with a warmer. Hey, you're not going to stick it in no microwave. It comes with a heating penalty warmer. So if the patient is complaining of stomach pain, you give them the warmer. Number 2, the second complication of peritoneal dialysis, number 2, is abnormal outflow or insufficient outflow. The problem with the students, they forget the complications for here versus the complication for here. They're not the same. You need to know peritoneal dialysis versus hemodialysis. Any question? Right? Turn. Then we're going to go into E. Go to E. I want you to put NCLEX 740. That peritonitis. Peritonitis is when the water is what color? Cloudy. That is a medical emergency. Peritonitis. What is peritonitis? God did. Poop. Infection in the blood. Yes, because bowel content goes into the what? The GI tract. The GI is distended and the patient can go into sepsis shock, which is a medical emergency. So the patient have fever, chills. This patient will be on IV antibiotic, vancomycin, and you will isolate this patient because vancomycin causes MRSA. Any question? You gonna do hemodialysis, you gonna read peritoneal dialysis, and you gonna listen to the tape 10 times. Okay? Here's your calendar for next week. Okay? Okay? Next week, I'm going to work